Welcome to another episode of Botox and Burpees. I'm Dr. Sam Rhee, plastic surgeon and CrossFit coach, host of this podcast where we talk about plastic surgery, CrossFit, and everything in between. You can find more information at our website, botoxandburpees.com, and make sure to like and subscribe wherever you listen to our podcast. Thank you, and welcome to another edition of Botox and Burpees. And this is a very important and special episode for us, and I'm glad to have our guest today, Dr. Christian Vercler. Dr. Vercler is an associate professor in the section of plastic surgery at the Department of Surgery in Michigan Medicine, which is where I trained for my plastic surgery residency. Dr. Vercler serves as the co-chair of the Clinical Ethics Service of the Center of Bioethics and Social Sciences in Medicine at the University of Michigan, and he is a diplomate of both the American Board of Surgery and the American Board of Plastic Surgery. Dr. Vercler received his Bachelor of Science degree in biology and Master of Arts at Theological Studies from Wheaton College in Illinois, and he attended medical school at the University of Illinois College of Medicine. He completed his general surgery training at Emory University and plastic surgery at the Harvard Plastic Surgery Program. He then did an additional fellowship in craniofacial surgery at the University of Michigan. Dr. Vercler has a special interest in medical ethics. He completed a fellowship in clinical ethics at the Emory University Center of Ethics and earned a Master's of Arts degree in bioethics from Trinity. Dr. Vercler serves as the chair of the Pediatric Ethics Committee of C.S. Mott Children's Hospital. He is co-chair of the Ethics Committee for Adults at Michigan Medicine, and he also serves as the Ethics Committee on the American Society of Plastic Surgeons, chair of the Michigan State Medical Society Ethics Committee, and is the chair of the Ethics Interest Group of the American Cleft Palate Craniofacial Association. That's a lot of hats to wear.
Yeah, too many. Luckily, I just rotated off the ASPS Ethics Committee. So that was a 3-year term, and I just finished up as chair of that. So.
Right. And you focus primarily on pediatric plastic surgery and craniofacial deformities in children and adults. And I know you have an extremely busy clinical practice as well. I do know your staff, Kim, who keeps track of your schedule. And I really appreciate you taking the time out of your really busy schedule to talk about social media and plastic surgery today.
Yeah, my pleasure. It's a passion of mine.
Okay, so I just wanted to talk about social media itself and how powerful is it as a means for advertising for plastic surgeons today?
It's incredibly powerful. If you think about advertising and being effective advertising, you want to be where people are, and everyone's on social media. So it's funny these days when you still see a plastic surgeon advertising on a billboard, because that's like so old school. But everyone lives in a social media milieu. So the idea that if you're not in social media, you're not relevant is it's a strong idea that I think is pervading our specialty, but it's not just our specialty. I think it's for anyone.
I think it's funny that as a specialty, we as plastic surgeons have a lot to catch up on. And I think some of my older colleagues, they will still say in conference, don't worry about social media, just build up your word of mouth. All you have to do is do good work, put your nose to the grindstone, and everything will be just fine, is really missing the point of how rapidly things have changed in terms of how people consume their information, how they make choices in terms of their daily lives, including choosing a surgeon, choosing their medical care, choosing cosmetic surgery particularly. And I feel like this rapid change is causing some growing pains and dissonance and conflict in our specialties amongst us. And I wanted to delve into it a little bit and see if we can make some sense about what might be great and what might be not so great about social media and plastic surgery.
Yeah, sure.
So I know you've written some articles about medutainment, which is basically defined in your article as using the patient-physician relationship as a source of entertainment in which to increase notoriety or attract patients, which demeans the surgeon's protective duty toward the patient. So what does that mean, medutainment?
Well, so I tried to coin it. I think one other person's used it in the literature before me, but it's this idea that, I'm just putting this out there to educate the public, when it's clearly objectifying the patient or taking advantage of their trust in you to show their body, which what's interesting is that you and I are used to viewing the naked body all the time. We're plastic surgeons. That's like what we do. Our journals that we get every month have all kinds of naked photo pictures in them. That's sort of we're used to that. The public sees that and perceptualizes it in a different way. And so when we take things that we think are sort of routine and we put it out in the public, it takes on a different meaning, and it gets a lot of hits. It gets a lot of engagement because it's something they don't see every day. Stuff that's kind of routine for us is not routine for the general public. And so I think that how I got into this whole thing was basically medical students and residents walking up to me with their phones out going, Dr. Vercler, have you seen this? Like, is this okay? And seeing this content and seeing people say over and over, yeah, I just do this for patient education. And you realize, well, no, it's actually pretty sensationalized stuff that isn't really that respectful. And so that idea of medutainment is really using our privileged relationship that we have and leveraging that for likes and tweets and retweets and follows and that sort of thing. And I think you can be educational and not sensational and not derogatory to patients. And I think that's kind of the fine line we need to walk. And that's sort of, yeah.
And what is that line? And I think that's where I think a lot of people will have disagreement about. I would say, and we could use different examples, but if a surgeon is showing surgery of a patient on social media, is that sensationalistic and entertaining, or is that educational?
Yeah, I think it can be both. The interesting thing, there's a Canadian, I guess he was a sociologist or communications theorist named Marshall McLuhan, who coined the phrase, the medium is the message. And really, this is like in the mid 20th century. But the idea is that the medium in which the message is expressed really determines a lot of what the meaning is. So even if we intend a message to be educational, the content may be the same, but in different contexts, it takes on a completely different meaning. So even though we may earnestly put out something that we think is educational, in the wrong medium, for example, like TikTok, which is, I have really young kids, and I try to keep them off TikTok, but they're always on TikTok. So if you look at the average age of TikTok users, it's pretty young. And so certain surgical procedures in that context may take on a different meaning given the context. And so this stuff sounds kind of nebulous, but I think it's real, and that the context within which you put a message, it really plays in significantly on how it's interpreted. And so that's the tricky thing, is that people may be interpreting things a certain way, even though we intend them to be fully educated.
Is that our responsibility as surgeons, though? Because we don't control the context in which it's displayed. These social media companies are algorithmic. They display
Right.
this stuff to people based on certain algorithms, based on that user's behavior. So it's not like we are proffering this to everyone out there immediately. If you're not interested in a particular subject, you're going to be not shown that, or you won't see it on your TikTok. It zeroes in on what you particularly are interested in. So we're not really controlling that context, are we?
It's interesting. We don't. And that's actually one of the scary things, is that content that we might put out is out of our control. And so the algorithm starts to control who sees it and whatnot. It's interesting professionally. The ASPS Code of Ethics says that we sort of have a responsibility to the public as physicians as well. And whether it's our responsibility or it's Facebook's or Meta's responsibility, that's like what's being debated now in this country, because it's interesting that Instagram blocks stuff that's hashtagged thinspo or Fitspo is very tightly regulated, because they know that people who are suffering from anorexia, for example, can use that hashtag to get into these spirals, and they know it's bad for their mental health. And so that's pretty tightly regulated. But apart from that, not much else is. People can think the elections are stolen because of these algorithms that feed people certain kinds of information. What we as physicians, how our responsibility is, it's tricky. But being a prudent person, I always think we should probably take that into account, how the things we put out may be interpreted.
Given how difficult it is for us to control our content, and given, especially for many of us in private practice, having significant exposure on social media can make or break your practice. I have seen personally the power of social media. When you have something that is of great interest to people, it just takes off like wildfire. And I've seen that, and I've seen other surgeons exploit that. Now, I do agree that there are some surgeons out there that, in my opinion, and I wouldn't know what other opinions are out there, but they might cross the line where I would feel comfortable. But I feel very wary telling other surgeons what the line should be for them. In my opinion, if they are maintaining appropriate patient care, they're not compromising a patient outcome for medutainment, then where are we to say that, I don't know, dancing in the OR or something like that, while not something I would do, not particularly respectful, maybe you might say, of what an operating room is, but does that blur the line between what is appropriate and inappropriate?
Yeah, I think it does. I think it's a gray area. What's interesting is that the ASPS Code of Ethics, which, because I was on the ethics committee for so long, I always had it printed out on my desk because I dealt with all the ethics violations that would get reported. But one of the things in the preamble here, it says treat people with ultimate respect, treat the profession with ultimate respect, strive to use accurate and respectful language and images in all communications. And so where those boundaries are is a question that we as a society try to answer. And specifically, I mean the American Society of Plastic Surgeons, because being a member of a professional organization is a choice that we make, and it's something that we pride ourselves in being members of, because we think it sets us apart from guys who are out there just selling their cosmetic products and not prioritizing patient care over everything else. As members of ASPS and board certified plastic surgeons, we think, you know what, we hold our heads high, we hold ourselves to a higher standard, and one of those higher standards is this kind of professionalism piece. Some people try to separate professionalism and ethics. It's difficult to find a bright line there, and a lot of professionalism complaints come to the ethics committee and it's all dealt with in the same way. But when it becomes unethical is when you sort of, like, at the very least, you have to get informed consent from your patients.
Of course.
Right? And some people aren't even doing that. So so it's like that's like the floor that you can't go below. Clearly that's like unethical. And then again, there's a large gray area, which I think is open to interpretation. Go ahead. Well, I was going to say, one of the things I'm always telling our residents, if you look I think it was the most popular TikTok of 2020, I think it was 2020, was Bella Porch bobbing her head to a really catchy tune. I'm not sure if you've seen it, but it had millions and millions and millions of views. And we're, as plastic surgeons, we pride ourselves in innovation. And her little cute thing was the most viewed TikTok, and it wasn't sensational. It wasn't trying to be sexy. It wasn't anything that was walking any kind of line. And so I think there's interesting ways to put out interesting content that isn't like trying to walk the line and be overtly objectifying patients' bodies.
I think you're right. I think it's extremely difficult to be a savvy social media person and do that as a physician, because that's not really our
not
job.
At all.
And I have tried, on the advice of others, like silly stuff like eating pizza or doing this and all sorts of other things. And it's a funny thing, social media. You can't ever determine what's going to go viral, what's going to catch people's interest. And everyone, I think, makes that choice to what they're going to commit themselves to within that medium. And I think that that's really why I feel, as a private practice plastic surgeon, I always have some concerns about our professional society's mandates, because I wonder where those thoughts are coming from. I do read those ethics bylaws. I do agree with them, but I also want to approach it from the most practical standard as well. Because I do remember when I was a resident, I was told you really shouldn't post your before and after pictures on a website. They are legal minefields. You are promising some sort of result to patients that you may not have because that patient that's in that before and after is completely different than the person looking at it.
Mm-hmm.
And now look where we are at this point. I feel like our society is very slow to respond to a number of issues that we who have our boots on the ground can maybe not feel like there isn't as much of a response to. And I trained at Michigan, and Michigan is probably the best place, I think, in America to train. There's no doubt that the faculty and the surgeons and the level of care there is unparalleled. And I am who I am because I trained at Michigan. But I also realize that the situation clinically and professionally at Michigan is pretty much unlike any other place that I've seen or been to. And I've been to a number of academic hospitals in New York and New Jersey. I've been in private practice. When I remember my mentors telling me back then not to post before and afters, and I also look at what's coming out of our professional society, I wonder, are they even able to keep up with the changes? And what are we teaching our young surgeons? Because we might be handicapping them. Like you said, there are a lot of people out there that are not licensed or not in a professional society like ASPS who have no ethics, or I don't want to say that, but are not following sort of the code of conduct that we generally follow. And yet maybe we're overly hamstrung to the point where we are not helping our young surgeons navigate this arena, and we're just telling them just avoid it, basically, when that's
Right.
probably not the best message for us to be giving them.
Yeah, for sure. I think telling them to, I've written a lot of stuff that seems pretty down on social media, but that's not my view at all. It's avoiding is definitely the wrong answer. In fact, we have a moral obligation to be on social media, posting appropriately. The fundamental principle behind this stuff is not deceiving the public and not trying to. Where it comes from is this idea that, look, we know a lot more about what's going on with the patient's body than they know. And there's a difference, and we can use that for good or evil, basically, right? We can do some smoke and mirrors and get patients to sign up for stuff, or we can be as straightforward as possible and make sure that they aren't being deceived. It's true, some people used to think that before and afters was somehow implying certain things, so that might be deceptive. The thing that I see now on social media is people showing before and after in completely different light. We know, and part of our training is how to take proper photography to document what things look like. And ASPS photographic standards, or the American Board of Plastic Surgery photographic standards, are often not followed on social media. And so I think in some ways can be deceptive to show a pre-op in a certain light, in a certain pose, to show a post-op in a certain light, in a certain pose, plus minus being airbrushed, can be deceptive. So those are things that we should go ahead and say, that's wrong. Don't try to deceive the public in that way. And that's what the ASPS Code of Ethics says. In your posts, make sure that you're maintaining photographic standards. And I have a colleague in New York, Rick Reich. He was a junior resident of mine. He posts, you should follow him. But he has beautiful rhinoplasty results, and all of them are posted in following the photographic standards so that anyone can see the results, aren't doctored, aren't shadowing is off or anything. He occasionally posts patient selfies, but they're in the mix with the photographic standards. So I think I always use him as an example of someone who's a young guy killing it in cosmetic surgery in Manhattan, who's maintaining appropriate standards of photographic standards and doing it the right way. In a way that's not deceptive. I think that's the biggest concern. I think really the two biggest concerns really are deceiving the public in some way, or misusing the patient's trust to have them let you use essentially naked photos of them, because those are much more interesting to look at online than anything else when you're scrolling through your feed. Whoa, what's this? And so those are the biggest, I think, ethical things to worry about. And then the rest of it is a lot of gray.
What do you think in terms of our responsibility and the patient's responsibility at this point? Because I know you in one of your articles, you had a hypothetical where there was a young patient who had breast reduction surgery, and she felt pressured to sign consents for social media. And then she was very surprised, shocked, and disappointed when her images were posted on social media. But and I assume it's a hypothetical, I don't know if it's true, but you also mentioned in this situation, this patient was an avid social media fan. She followed this surgeon on all of his social media, and she saw exactly what this surgeon's social media stream was. So wouldn't it also be incumbent on the patient not to be shocked when she sees all these other patients being posted on social media? She's asked to be posted on social media, and then she's surprised and disappointed when she's on social media?
Yeah, that hypothetical was a kind of a conglomerate of a couple different issues that I've heard people experience. But we advocated in some of our publications that you should really, to get truly informed consent, you should show the patient the post before it goes up, so that they know what the context is. There's been some people who've gotten in trouble for showing a part of a patient on the Mayo stand, and then whatever it's hashtagged can change the meaning, right? Or be extremely derogatory. And so again, well, hey, we're going to cut this thing off of you. Is it okay if we show it? Okay, sure. Well, what are you going to put as the hashtag? That potentially could be, again, change the meaning to something that you didn't really think you were signing up for.
Absolutely. If you hashtag it beautiful change, that's very different than, say, disgusting piece of meat cut off of some whale or something like that.
Right. Yeah. They have this lazy bastard
Right.
who couldn't go to the gym, so we now edit.
Right. Yes. And I understand that. But does that really mandate pre-clearing this with the patient? Because we don't pre-clear anything that we've posted for any other medium for the patient, as long as we get informed consent for before and afters or other things or even, for example, I know hospitals and other physicians do interviews with patients. They post those for their hospitals in terms of patient care and maybe a journey that they've had in terms of some sort of medical care they've received. I've never seen hospital media departments pre-clear that with the patient or patient's families in order to say, is this okay? They get their permission to record, they do it, and then essentially the patient's trusting the surgeon not to abuse or somehow show it in an unflattering light. But then
Right.
that's not illegal. That's just scummy on the surgeon's part, isn't it?
Right. Yeah. I think that's probably right. I think hospitals, though, I haven't seen a lot of derogatory stuff being posted by hospitals.
Right.
But I have seen a lot of plastic surgeons posting derogatory stuff about patients. So that's the difference. And I think why we're even talking about this is that I think everybody knows that they've seen some stuff that raises an eyebrow by plastic surgeons or people doing cosmetic surgery. And so, again, I do live in a bit of an ivory tower, I guess, but I also have a group of faculty ethicists that are my colleagues. And when they see stuff on social media, they're outraged. We live I'm talking to other plastic surgeons most of the time, but when I have folks who are physicians who aren't plastic surgeons or who are just ethicists, they just can't believe some of the stuff that gets posted and want to know, how is that okay for you guys to do that?
I agree, but the problem is that I feel like these are sometimes my personal feelings. So, like, for example, I did see on TikTok, there's a plastic surgeon, and he likes to play around with breast implants. So sometimes he's kicking them, sometimes he takes a Theragun and he's doing a pressure gun onto them, and he's doing all these sort of things, which I found not particularly to my taste, and I really disliked it, actually. But when I talked to my colleagues about it, and I said, did you see this guy? He was taking these implants and dancing and kicking them. They're like, yeah, but if he's not compromising patient care, these are samples, and obviously they're not ones he's actually using. So it's in poor taste, and I wouldn't do it, but is that unethical and maybe borderline unprofessional? But how am I supposed to say to someone else, because it's relative to a certain degree, is it not?
Yeah, so I think I definitely agree. Not unethical, probably not smart, not prudent. If you go through life trying to figure out how to avoid problems rather than, I'm not a mountain climber. I don't take huge risks, but yeah, potentially you could argue that's unprofessional. It's not maintaining the dignity of the profession, which is how the ASPS Code of Ethics states it. Would behavior like that look good in a court of law if, let's say, someone said I was treated in some way that and they're trying to sue you for malpractice, and your defense attorney has to try to explain why that's, because they're going to make the case this guy behaves this way, and then do you want that stuff in front of a jury? Again, not prudent, but not sure that I'd say it's unethical per se, that sort of clownish behavior. I think that's the thing that where I might say that's fine if you're using social media to brand build and you want your brand to be a jovial, kind of jokey person. I think that's probably fine. It may get you in trouble, it may not, but I wouldn't necessarily say that stuff. Again, we might find it distasteful. I don't know that that's unethical. The stuff that I see that makes me really a little bit concerned is where it's the greased up BBL post-op patient with playing rap music with very suggestive lines, zooming in and zooming out, where it's almost like you're trying to make some sort of sexy rap video with the patient's naked body on the OR table. And that's one of those things where I say consent is necessary but not sufficient, because people will say, well, I got consent. The patient consented for me to do that. But is that truly like really maintaining the dignity of the patient to treat him in such an objectified way?
Let me take devil's advocate there.
Yeah.
I agree with you, but I would say that there would be some that would say this is an express if it's done not only with the patient's consent, but say with their explicit instruction, maybe. I want you to show off my booty. I want you to show off how snatched I am. I want you to do this. And in fact, I endorse it. Would that not be considered maybe an free expression of agency, owning your body, owning the fact that you've had plastic surgery, not being afraid to display it in a sexual and proud and free manner, and not hiding it basically or trying to be reticent about it?
No, for sure. And I think that's where it's a little distinction. So whether it's you posting that or it's the patient posting it, I think is a little bit different. We wouldn't want to say that our professional society or our professional obligations as physicians we should tell the patients, don't post pictures of yourself like that. No, this is why we do what we do. We want patients to feel so good about their bodies that they're happy to do that. The thing that's a little bit, again, sketchy, I think, is showing things like that where you might say, oh, look at me, I'm just educating the public. Well, no, actually, that's pretty interesting content to a 14-year-old in ways that's not necessarily what you're intending to show, and you really are treating the person like a piece of meat. And so let the patient post their own thing, but think about your responsibilities to society and the dignity of the profession, as well as the patient's own, dignity, and try to kind of uphold that line. What I often say is that, what the secular trend is, so to speak, isn't always what, again, that high standard of what we say our professional societies hold us to, which makes us better. You say, okay, we did all this extra training. We're always going to put the patient's concerns above all other concerns as part of our professional responsibility. So we're not always just going to go to the lowest common denominator for the most number of likes.
Agreed. I would say I have friends who are I don't feel like they're in competition, but they feel like they're in competition. And sometimes it's a race to the bottom. And I wish we could provide them with better advice about how to deal with those types of situations where there are people doing that. They might feel a lot of pressure to do something similar. And I wish we could help them to navigate it professionally without having to coarsen themselves and be, like you said, to get to that point. But it, like you said, it is difficult.
Well, it's so tough. I think it's so tough because we are surrounded as plastic surgeons by extremely visually interesting content, right? Our lives, what we do every day is really awesome.
Absolutely.
And really cool. And that's why we love doing it so much. And so it seems like, well, if I just put this out there, people will like it. And they do. But are we crossing the line? And so it's just so hard, I think, for us to get out of our own way and get perspective on what it really means when we do that kind of stuff. Because it's so easy to just say, look how awesome these breasts are now. Let's put those online.
Right.
Is that the best? I don't just mean to talk about breast dog post-ops, but I think there's ways to do it that's better and worse.
You can get every episode of Botox and Burpees wherever you listen to podcasts, or go to BotoxandBurpees.com. Thanks for listening.